Let's talk about ketamine. Or Ketalar. Most commonly known as ketamine. Street drug, special K. We're not using it as a street drug. We're using this as an actual medication. Class is a dissociative anesthetic. We talked about dissociatives before. It disconnects the cortex, the limbic, from the cortex, disassociating the consciousness from the subconscious, if you will, and giving a general anesthetic effect. So our action, again, causes disassociation, between the cortical and limbic systems. What are our indications for this? Well, it's a dissociative anesthetic, so we're looking at it for sedation, procedural sedation, such as in the ER for resetting of bones, in kids, stitches, any kind of minor procedure that can be done in the emergency room more efficiently, more effectively than in the OR. You can put them under a conscious sedation. They are not completely asleep, however they are sedated enough that they are disassociated from what's going on, and they're relaxed enough that you can, and pain relieved enough that you can actually reset bones, do stitches, do minor procedures, abscess drainage, that kind of thing in the ER safely. The effects are very short-lived. So this is what it's generally used for. Anesthetic. It does have some effects on the lungs, where it opens the lungs. This is used a lot in asthmatics, severe asthmatics, status asthmaticus. Ketamine can be given and is given in larger hospitals for asthma patients. It helps decrease the anxiety through its sedative effects, and also through the secondary benefit or side effect, if you will. It does open the airways. It tends to relieve the effects of asthma as well while being given. Contraindications. We're not going to give this, of course, if they're allergic or hypersensitive. Allergic or allergy, or they're hypertensive. If their blood pressure is up, already high, we don't want to make it worse, and that is a side effect of ketamine, is it can push the blood pressure up. So our dosing is a little different. It's a weight-based dosing. So we're going to give this at 0.5 to 1 milligram per kilogram. So 0.5 to 1 milligram per kilogram. Up to a maximum, most generally a maximum of 3 milligrams per kilogram, depending on the doctor, depending on the protocols, and depending on what the ER is doing. You can overdose on this and become a general anesthetic, which that is getting into needing anesthesiology or a CRNA to perform this and to monitor this under procedural sedation or under general anti-anxiety or pain relief analgesia, that would be something that you would be more in the 0.5 to 1 range. And then of course IM, it would be due to the slower absorption rate and such, 2 to 4 milligrams per kilogram IM. This is IV. So now that being said, it can be given, its routing is IV, IM. This is not taken orally or rectally or any otherly, only through IV and IM. Adverse effects, hallucinations. Hallucinations. We call them emergence reactions. Once they go under for procedural sedation and they're completely sedated, they can be dreaming. They can be, it's almost like a dream state or a subconscious state. I've seen happy, they come out singing songs, acting like younger kids, just being silly. And I've seen the exact opposite. They've had bad dreams, nightmares, that kind of thing, night terrors, especially if they have history of night terrors. This can bring those out as well. It is something that in the ER you may possibly see, you may not see. It just depends on what's going on, of course. But just know that they can come out of it bad as well. So with anything else, when using ketamine, especially in the emergency room setting, you will notice that there will be a nurse with that patient generally at all times. Most often, once a person is being procedurally sedated, nobody leaves their side. There will be a doctor and a nurse in there both. Also, all monitoring will be in place, and there will be a crash cart close by. Just precautionary due to the nature of the procedure and what's going on. That is the requirement. If you're going to have a patient on ketamine for procedural sedation, they will be monitored, cardiac, end tidal, SpO2, blood pressure, everything.